Yeah, so hi everyone, I'm Hillary Kane. I'm the director of an organization called FEND. It's the Philadelphia Higher Education Network for Neighborhood Development, a mouthful, but we are a local higher ed consortium in and around Philadelphia, based at Penn, but I always joke pretending to not be so that every institution in our network feels equally involved. But we support and promote campus community partnerships, civic engagement, a little bit of anchor institution work, and we also happen to run a couple of AmeriCorps programs. And so, at least for the time being, while AmeriCorps is still around, we are,
Yeah.
we've always been thinking about housing as a pain point, certainly for our AmeriCorps members,
Hmm.
but then also just, as student collegiate basic needs becomes more of a concern and there's more low income and first gen students on campuses, housing is a concern for students and and the cost of housing, especially if it's a non-traditional student. So we're sort of thinking about it from all angles, but also thinking about it, not necessarily as a campus, but thinking about it on behalf of our city and region.
And Hillary, you and I once had a fun brainstorming session with some others about this idea of almost group housing with people that are doing AmeriCorps, which I think is a very replicable model. And I
Yep.
thought maybe you could just share that concept because I think it's a good one.
Yeah, I mean, so there's a few models out there. There is something that there's a plan to, or some cities have been able to put senior housing and AmeriCorps together, so helping older adults age in place. And this is maybe a little similar to what Drexel is doing with their second story that I know has presented on a previous call.
Hmm.
But a lot of older adults have spare bedrooms in their homes and could use some extra rental income. And here's this young person who might, need a space for a year, and in addition to like lower, cheaper rent, maybe they, take the trash out and, change the light bulb, not like doing home healthcare serious work, but,
Hmm.
some occasional things and just, as another companion to end senior,
Hmm.
senior isolation is obviously a big issue. So there's those kinds of models, but then, the weeds of, is that senior now a landlord? And do they have to pay in Philadelphia business privilege tax? And what if the house isn't up to code? And what if the
Right.
AmeriCorps member needs to get evicted because they're smoking weed? Like,
Yeah. Yeah.
it
Right.
becomes not like this a great idea on paper becomes really hard to actually implement.
Yeah.
And then the other thing that we've been looking at is out of Louisville, there's this program called Family Scholar House, and that is really affordable housing for parenting college students. So, college students who themselves have kids, which could be either like teen moms now going to school or older adults going back to school. Neither our campuses are not designed for either population. Um, and there, I know in Louisville, like because they're also an AmeriCorps grantee, they think they have AmeriCorps in the mix.
Mm.
But it's more designed for that population of students. And there's now several replications around the country. Like Cleveland has one, Pittsburgh has
Nice.
one, Philadelphia should have one.
Yeah, working on it. I think
Yeah,
it's a
yeah,
great idea. Well, and I
exactly.
think it aligns with everything that we've been doing in this series over the last couple of months. So I've started to record our series. So I'll officially welcome viewers to the fifth installment of a webinar series we're doing for Campus Compact on what affordable housing and anchor institutions kind of ought to know about each other as sectors. And we're delighted today to have the what we call HAN, or the Healthcare Anchor Network, presenting on their work, which I think is really relevant to the anchor field. You've got their biographies, which have been sent in advance and will be sent as a follow-up along with this video so we can save time on introductions, and will allow them to kind of begin their presentation. They're going to walk us through who they are, what they do, and how they have turned their own attention as advocates to the topic of affordable housing. So I'll turn it over to um, Kate and Dave from Health Anchor Network. Thanks.
Thanks, Tony. We appreciate the invitation to be with everyone today. And so I'm Dave Zuckerman, president and founder of the Healthcare Anchor Network. Been leading it since its inception, and have really been both a researcher and passionate advocate for anchor strategies beyond healthcare for about 15 years. But my primary focus is in healthcare, and joined today by Kate Gallagher, our Senior Manager for Place-Based Investing and Policy, who will split this presentation with me. And so I think we are delighted to be welcomed into this space of higher ed. And most of my time these days is spent in healthcare. But I think what we want to really share with you is about some of the strategies in healthcare that are being used to address issues of affordable housing, and with the caveat that these are not strategies that only healthcare can do, and really talk about it from the perspective of the assets that healthcare is leveraging that higher ed also has that can be leveraged in service of these strategies. And in fact, Kate will touch on some examples where higher ed is partnering with healthcare as part of these strategies to address affordable housing in urban and rural communities. So I think we really see an opportunity across the board, and it's really about how can higher ed and other anchors be open to leveraging their resources differently, come to the table in with the idea of how they can partner differently. And I think if that happens, we can have more strategies to holistically address affordable housing in our communities across the country. So I'll just touch briefly on who Han is, really talk about our frame as we think about the resources that healthcare has for tackling this, and then I'll pass it off to Kate, who will touch on some of the commitments we've seen from our members in the Healthcare Anchor Network, and then some case studies that are probably the things you're most interested in learning about. So our frame really is that this is both mission aligned and good business. The strategies we're going to talk about, we believe, work at the intersection of sustainable interventions in the community that also are addressing the broader mission of healthcare organizations across the country, and that I think also applies to the higher ed sector too. So we're going to specifically talk about investment on this call, but we do have other strategies that we ask our health systems to think about, including workforce development, supply chain, and other ways they can create more inclusive local economies. And our frame is really this idea of this intentional commitment. We see higher ed, we see healthcare as de facto anchors. And it's really a question of, okay, given your position, are you going to take on the responsibility and the intentionality to apply those resources to have the most impact in your community? And when we see that happen, we call that the anchor mission. And we really see that as going beyond ad hoc good things, going beyond just community engagement, but really getting at leveraging the core economic resources that the institutions have to have the most impact. And as you can see, our 75 plus members, 40% of nonprofit healthcare, employ a tremendous amount of people, purchase a tremendous amount of things, and have significant investment portfolios. And it's not about shifting every one of these resources, but even shifting 1, 2, 3% of these activities can have massive ripple effects when it's targeted at the neighborhood and community level within the footprint institutions serve. So I'm not going to touch on all of these things, but Han is a very active network. We provide a lot of support to our members, and that ranges from case studies and reports on one end to actually trying to establish what best in class looks like in these different pillars. And Kate will touch on that a little bit in terms of what that looks like in the investment pillar specifically. But a lot of other activities fall into the place of learning communities. We have a very robust data collection process. We provide significant technical assistance to our members. And in a few cases, we go much more in depth with a handful of our 75 members with tailored technical assistance in kind of a cohort like fashion to hopefully create some of those next best practices in the sector. So as I shared, we focus on workforce supply chain investing. We increasingly have an emphasis also on policy advocacy, how grant making can accelerate this work. And when I define place-based investing, investing for us are not grants. So that is something I'll come back to. How you can use your land as an asset in some of these projects, and how can you also tap into the tremendous um, intellectual capacity and skills of your organization and use that in a way not just for 5Ks and trash pickup, but really to build the capacity of local community-based organizations. So we think about five assets that health systems have and that universities have as well that can be really used in service of addressing the affordable housing issue in many of our communities. Obviously, you can use your voice to s- to advocate for local and state policy that might make bring more resources to affordable housing. We actually have a strategy at the national level where we organize our health systems. So not going to spend too much time on that, but just wanted to name that. Relationships, obviously, is one of the largest employers. You have unique set of relationships. Real estate, a significant amount of land that might be able to be an input to these affordable housing projects. So you might be able to help claim vacant land and repurpose it, or if you're building a new building, there might be a way to attach affordable housing to it. We see that with some of the FQHCs that our health systems are supporting. Grant making is, of course, the most obvious way that some organizations bring resources to this, but I would also say it's probably the most limited of these five because there are just not enough grant dollars to go around. But it may help get a project over the finish line that just needs some type of subsidy. And what we're really going to be talking about today are investments. Your organizations have endowments, they have long term reserves, health systems have investment portfolios, and this represents an opportunity to leverage the balance sheet of the organization to make some sustainable investments that will produce an economic return and a social impact to support affordable housing projects in your community. And so the way that we define impact investing is really on this continuum. Your organizations have traditional investing strategies, perhaps have applied some social screens to those investments over the years, but those are really in mutual funds and in bonds in the traditional public markets. And they're not being redirected into your local communities. And what we see and advocate for is a carve out of a portion of those resources to be deployed for primarily low interest loans to support critical community projects in your footprint. And for the most part, um, this looks like affordable housing. We do see other efforts where health systems are supporting providing capital for small and diverse businesses, maybe trying to support a loan for a grocery store. But for today's conversation, we'll focus on how they're providing these loans for affordable housing. None of these are grants. Nothing we're going to talk about are grants. In all the situations, the organization gets the money back with a return on interest. Usually, that interest is below what the market rate would have been for that same product if it was in the public markets. But in the process of reducing the interest rate, making the capital more flexible, extending the duration of the capital, an organization is able to help critical projects in their communities that otherwise would not get across the finish line, make that happen. And that's the point of this. You get your money back, you have a social impact, and you help really create a win-win that goes well beyond the cost of um, the time and energy you put into this effort. So for us, we have a very short checklist that we ask our systems to think about and would encourage higher ed to think about as well, which is, does it preserve the principle? So again, do you get your money back? Does it address a community priority? And we really want these projects to not only be about healthcare access and not to only benefit your own patients, employees, or plan members. We're really encouraging our partners to see how the win-win can happen at the community level, the ecosystem level. Maybe it is workforce housing that is primarily going to be advertised to healthcare employees or employees of your institution, but it's not restricted to only those employees or those individuals. And so, obviously, the deeper the subsidy, the broader the frame around who's being encouraged to live there, the more impact you're going to have on the community that you are situated in. And hopefully, in the process of working with other anchors, you'll also be able to create a more um, intentional, strategic approach to addressing the problem at the system level instead of on the one off institutional level. And so, why? Why is this needed? I think all of you are talking about the affordable housing issues in your community. This is a quote from a partner of ours at the Center for Community Investment. But really, this is about filling gaps where the markets aren't working. We have an affordable housing shortage because the private markets are not addressing the affordability level that we need to see. And therefore, we need institutional anchor investors that come in and fill the gaps. For us, this is also about how do we get further upstream? How do we leverage resources sustainably to actually get at the things that shape health and create economic opportunity? For in the healthcare setting, we're seeing health systems helping pay rent for people or helping them not get evicted. That's great. It's very individual focused. It's probably not sustainable in the current environment. And so instead, if you can leverage your balance sheet, the money that you need to invest for the long term into projects that are also going to produce new units for your community, why would you not do that? So I will pass it off here to Kate to talk about what commitment looks like in the healthcare anchor network and then some examples of this work in practice.
Thanks, Dave. You want to stop screen sharing and I can take over from here?
Perfect.
All right. How's that look? Great. So Dave has mentioned this a few times in terms of what we ask of our members when they are making commitments to place-based investing. Han is a network of around 75 health systems across the country. Not all of them have made this commitment, but I'll share more about who has on the next slide. For those who sign our place-based investing leadership commitment, they're allocating 1%, usually 1%, or at the time that they signed the commitment, $50 million of their long-term unrestricted investment funds for basically geographically targeted impact investing. And this is, like Dave mentioned, long-term investment portfolios that are typically invested in like traditional stocks and bonds. So these are long-term, they're usually producing a market rate of return. And so we're asking for a 1% carve out of that portfolio to just be directed into your community towards projects that are having a direct benefit for patients and employees and other community members. We ask also that they're deploying within 5 years and that they also are submitting data to us on an annual basis. These are the members at HAN. We're happy to follow up with you if you're interested in knowing whether a health system in your community is doing this work. That's a lot of what we do is, making connections and helping educate folks on the work that's happening. Some of these are our members. 14 of them are actually signatories of that leadership commitment. There's several others on here are, either just getting started on a place-based investing strategy or have made some really impactful investments that I'll share more about. One thing I want to point out about this list is that it's a bit of a misconception that in this sort of impact investing work is something that only a large health system can do. You'll see a lot of large health systems on this list, Trinity Health, Kaiser Permanente, but there's also some smaller health systems on here that have really become leaders in our network in this practice. Hawaii Pacific Health in particular, UMass Memorial Health is another smaller health system. And what we see is that, yes, the total dollars that they're able to commit to this strategy might be less, but they're also incredibly nimble and flexible and have really deep community partnerships that they're able to really have an impact in their community and bring others to the table. So what does this look like? I think we've kind of talked conceptually about place-based investing up until this point. What does this place-based investing look like in terms of scale across healthcare anchor network members specifically? We will have new data coming soon, but for now we're looking at fiscal year 23. Dave mentioned that we have a pretty robust data collection effort at HAN, and that is where these numbers are coming from. So total allocations to place-based investing by HAN members is, as of fiscal year 23, was 1.27 billion. This is those dollar amounts that have been formally carved out or set aside for place-based investing specifically. Again, this includes dollars that are expected to return to the health system, so it doesn't include any grants or donations or philanthropic dollars or anything like that. And of that 1.27 billion, about 794 million has been deployed or committed. So these are dollars that have been legally obligated for a specific project or to a specific organization as a place-based investment. And these are all investments that aim to really improve the community conditions that shape health, as Dave mentioned. So we're talking about, of course, access to stable and affordable housing, but also, access to opportunities to build wealth through a local small business, opportunities to, access more nutritious food through a local grocery store. So there's a lot of different ways that this looks. And just to give you an idea of how these investments are focused, the darker blue dots here are in the affordable housing category. So affordable housing continues to be the largest area of focus for place-based investments by HAN members. As of fiscal year 23, there's been approximately 550 million, or 71% of the total, that has gone to the production and preservation of affordable housing. And that has supported approximately 32,000 units of affordable housing across the country. And this is from our last year, so we do expect that this number has actually increased. So the vast majority of these investments, just to bring back to something that Dave said, the vast majority of these are low interest loans that are either supporting a specific, affordable housing development in a community, or I think increasingly so, these are investments with intermediaries or contributions to housing funds that are aggregating capital from a lot of different sources and then financing specific projects in the community. So that'll become more clear, I think, as I walk into some examples. Obviously not a surprise to any of you why housing would be a main focus for healthcare and for higher ed. Similarly to you all, for our members, housing access and affordability is a salient issue for every single stakeholder group that the health system serves. So for patients, of course, but also increasingly for employees and just generally for the communities that they serve. So the second largest piece here is around financial inclusion and economic opportunity. $144 million has gone to that. That is primarily contributions to or investments with community development financial institutions. And these are organizations in your community that have a mandate to provide affordable financial products, particularly in low-income communities. So this is increasing those organizations' ability to provide, loans that help counter predatory lending practices from payday lenders, and making sure people have access to capital to grow their business, buy a car, and hire employees, things like that. And then there's the remainder of the investments here are in nutrition and food access and a couple of other categories. So now I'll walk through a few case studies from our members. And we've tried to pull out here some examples where there have been higher ed organizations involved. It's not always the case for these. And as Dave said, there's some of these, structures could be easily applied with institutions outside of healthcare. But just to start with Dartmouth Health, they are a smaller healthcare anchor network member. They have about 9 community hospitals and clinics across New Hampshire and Vermont. And they have investments with 2 financial intermediaries. The first is the New Hampshire Community Loan Fund, where they have provided $5 million at 1.5% interest since 2020. And the New Hampshire Community Loan Fund is best known for a model that they provide financing for residents of manufactured home parks to be able to purchase their land and to become resident-owned communities. And so this is a strategy that primarily supports rural communities in being able to fend off some of the really predatory practices of private equity. And it's a model that they've been able to scale nationwide. And the treasurer of Dartmouth Health was initially quite skeptical of place-based investing as a practice. It's something they had never done before. And it was really to the credit of the New Hampshire Community Loan Fund that helped them become comfortable with this concept, such that they were then able to pull together some local employers, including Dartmouth College and several others, to put their heads together on what they could do about a fund that would specifically support the production of workforce housing in the Upper Valley region of New Hampshire and Vermont. So this grew from this regional convening of employers, which included the 2 anchors, but also that included, several banks. There was a small food co-op chain. that it participated, King Arthur Baking, a company you might have heard of. And they all had this sort of shared issue of not being able to attract employees or retain employees to the area because of the high cost of housing. And so they were able to pull together their resources and find a really great local partner as an intermediary who then they started this Upper Valley Loan Fund. It started off as a $10 million fund. And it was really the purpose of building affordable and workforce rental housing in the Upper Valley region. And so Dartmouth Health and Dartmouth College are the largest investors. They've provided a total of $6 million at 1.5% interest. Again, this was a co-investment with these several other institutional investors. They've financed about 4 housing projects so far and almost 200 units. And the units that they're building are coming in at around $600 below the market rate for other units in the area. And so I just want to bring back something that Dave mentioned, which is that these units that they're building, they might be advertised to the employees of these organizations, but they're not restricted to the employees. And so this is really something that is having a benefit to the community at large, rather than just being a sort of workforce retention and strategy for the organizations that contributed to the fund. Next, we have UC San Francisco. This is UCSF. They launched a investment pilot in 2021, and they set aside $5 million for that was deployed to 4 financial intermediaries. One of them was the San Francisco Housing Accelerator Fund. And the way that these intermediaries were selected was through a RFP process. So they had a community advisory board. They, put out the call to the community and said, this is broadly what we're trying to do. If your organization has, a pipeline of investments that we can help support, we want to hear from you. And they selected the intermediaries that way. They provided $1.5 million to the fund at 1% interest. This is a model that has since, it's sort of served as a national model. From what I understand, it's a the San Francisco Housing Accelerator Fund. It's a public-private partnership that provides acquisition loans to nonprofit developers so that they're able to essentially compete with the private market when multifamily properties go up for sale. And so they're really looking to prevent displacement by having the housing developments be, purchased up and converted to market rate rentals. So UCSF, they've wrapped up their pilot. This was a 3-year pilot for them, and it's sort of a first of its kind for the University of California system specifically. So they're sort of looking now at, what they can do to bring this type of practice to the other UC campuses. Another example is the Boston Acquisition Fund. This is, again, a revolving loan fund that offers low interest capital to nonprofits and community land trust and other socially minded developers to acquire multifamily properties and prevent those properties from being converted to market rate rentals. This effort was actually grown out of the mayor's office in Boston, but there's 10 founding partners that include several HON members and other local foundations and health-focused institutions. Similar to the Housing Accelerator Fund I spoke about on the last slide, this is primarily a housing preservation and anti-displacement strategy. So they're looking at being able to protect 700 units of housing in Boston and prevent about 2,000 people from being displaced. Something I like about this example is that this actually grew out of a grant-funded program that supported housing. So they had some ARPA funding that they were able to provide some financial support, mostly grant funds, to nonprofit developers to help them acquire properties. They were finding that the developers still had a need to be able to come up with the financing to cover these projects. And so they realized that there was a need for a revolving loan program that could lower the cost of capital for these organizations, which is why they built on the success of the grant program to now launch the acquisition fund. And they have a target of raising $25 million, and they've raised about $13 million already. And about 8 million of that has come from the 10 founding partners in the form of low interest loans, long-term low interest loans. And I won't spend too much more time on the examples here because you'll start to see a pattern. A lot of these funds are structured similarly. But Intermountain Health is really a leader at the Healthcare Anchor Network in their place-based investing work, particularly in terms of scale. They've deployed over $100 million across across 6 states. And the vast majority of that has gone to affordable housing. As you can see, $93 million for affordable housing. They also contributed to a fund, and what I wanted to point out about the Utah Housing Preservation Fund, it's also a national model, but again, this is a multi-sector group of partners who came together to launch this fund in Utah. And what's unique about this as well is that they have been able to secure appropriations from the state of Utah that the state of Utah has now contributed about $50 million to match the private investment that was provided for the organizations listed here. They were also doing some really interesting work to sort of quantify the savings that result from their purchasing of properties and keeping the properties operating at below market rate. And they're estimating that the tenants save about $367 per month, or about $4,400 annually, and that across the portfolio of properties that are included or that were included in this fund, that's saving residents about $4.5 million annually in avoided rent hikes. So, showing sort of the wealth building component of that as well. And then finally, I just want to talk about something that every institution could do tomorrow to support some of the local, efforts to increase economic mobility, particularly, but just to support the community investment ecosystem. All of the examples that I talked about, launching a fund takes a long time. And it can take several years to sort of coordinate partners. And I don't want to, we need to recognize that it's a significant effort that folks will need to go through. And so I just wanted to share this example of St. Louis that demonstrates how, community-minded investors can make more of an immediate impact. They can do this by essentially just shifting some of their cash into a portion of their cash into a community bank or credit union. And this is something that BJC Healthcare, SSM Health, and the James S. McDonald Foundation did in St. Louis with the St. Louis Community Credit Union. Collectively, they, contributed $15 million to this community impact deposit program. And from our perspective, access to affordable, non-predatory financial services is a social driver of health. And, when people can purchase a home or expand their business, hire people, these are all important ways that people are able to increase their health and well-being and economic mobility. So just wanted to end on that as something that if the other examples, start to feel intimidating, that this is something you or I, could or should do tomorrow, and something that each institution should consider. So I'll wrap up there, and I hope that this has sparked some ideas about what's possible. But yeah, we can pause now for any questions.
I mean, absolutely terrific. Both of you, what a tremendous slide presentation. Hi, Sarah. I see Sarah has joined us from up there in Amherst. They were just talking about New England. I don't know how much of that you may have heard, but there's some really good stuff in there. So Dave and Kate, thank you both very much. I've got a few questions, and then I'm sure our colleagues have a few questions as well. I want to start, and Dave, I'll start with something that you were talking about with the rural and the urban. And I'm curious if you're noticing any trends where the demand for affordable housing is tilting one way or the other, rural or urban. And I'm sure you and the organization pay so much attention to the federal government and trends in funding and trends in policy. Are you seeing anything at the federal or even at the state level where the public sector is tilting one way or the other towards cities or rural areas and how they support housing? Or is it even? The reason I ask, it's mostly been thought of as an urban issue, but most recently, there are a lot of affordable housing insecure issues in the rural parts of our country.
And
Any thoughts?
isn't every community issue, rural,
Mhm.
urban, suburban in this country? I think that there are more partners that are ready to get to work on this in urban communities. You have
Mhm.
more high capacity community development financial institutions. What Kate was saying, it's takes some time to build a fund. Working with the CDFI, you don't need to build a fund. You just need to enter into a relationship, making an impact investment with them, and working to help them build a pipeline in your community. In a more rural community like what Dartmouth did, you may need to convene other anchors and help build a fund, but even they are looking at how to replicate that fund and reduce the amount of time it took to build their initial fund. An organization like Intermountain brought capacity onto their own staff to really be more sophisticated around structuring these deals, and so that's allowed them in an environment like Utah, where there are again not as many clear partners from day one, to put together some really impressive projects to address affordable housing in the state. Um, One of the strategies on the policy front, for the last 7 years, we've been organizing our health system partners to go to the federal level to advocate for both policy as well as affordable housing policy. And at the federal level, there are basically two main mechanisms for funding affordable housing. There's LIHTC, low income housing tax credits, and the home program. And up until last year, they had been increasing in their resources. Of course, the the bill this year had the reconciliation bill had many awful things in it, but it did actually have a significant increase in the low income housing tax credit. So it's, hard to celebrate it just because of how
Mhm.
many other awful things were in this legislation, but it is the largest expansion of the low income housing tax credit in I think ever. Maybe
Mm.
don't quote me on that part, but it's very significant. It makes it more flexible for projects, and in many of these projects, the other piece of the funding puzzle beyond patient capital from anchors are low income housing tax credits,
Awesome.
and in some cases, the dollars from the home program.
I have a follow-up question for both of you, for Dave and for Kate. Kate, I was very impressed with the number that you put out. It was the 551 million number that generated 2,000 units. I mean, that's really an impressive amount of money and an impressive amount of output. And a lot of it was through this low, or most of it was the low interest loans support, which was great. I'm curious if you're both seeing trends where nonprofit developers of affordable housing are the more prominent developer. Are you seeing any trends with for-profit developers in these partnerships? And any advice for anyone who's working with a nonprofit developer versus a for-profit developer that you've picked up over the years?
Yeah, I can answer that. I would say the vast majority are with nonprofit developers. But I I think that it doesn't disqualify you. Well, in some cases, I think that they're focused primarily on lending to nonprofit developers. In other cases, what I've seen is that they'll, look for mission aligned for-profit developers. And it's not just about signaling mission alignment, but it's about setting up the project to make sure that, there's affordability restrictions, any excess profits that come from the project are perhaps redistributed into the development for upgrades or what have you. And so that's what I've seen for willingness to consider for-profit developers, is that there's that sort of still commitment to not being predatory and to
Yeah.
not getting us ourselves back into sort of the situation where folks are being displaced, and there needs to be some like contracting like language and agreements that
Mhm.
makes sure that that's happening.
Yeah, I'll just second that I think the values component, and then of course it's going to be part of your own assessment of your environment. In Massachusetts, you're probably going to have very high nonprofit high capacity nonprofit developers in maybe a rural state or a state with less community development infrastructure, you're going to need to look for mission aligned
Mhm.
for-profit partners. Um, I think the other piece of that as well is that just the kind of from a terminology perspective, most of the investments are not with the developer. They're with an intermediary that will then work with the developer. So I think just noting that most of these projects are not directly with one developer. Some cases that it does happen, or maybe they're working with intermediary and they're really asking that intermediary to prioritize certain types of developers, but I think just kind of noting that dimension of it.
Nice, thank you. That's a very good point. I was impressed by the number of intermediaries that form around these different projects that you've shown, whether it's the Northeast or out in the West or in the Rocky or Central area, St. Louis in particular, all very impressive. And it's impressive to see the capital stacks being contributed to from government as well as, say, private foundations.
Mm-hmm.
That's something that we're seeing more in the anchor institution space. What is the role of a community foundation or a place-based foundation in joining forces with anchors to try to enhance the quality of life, whether it is about being housing insecure, food insecure, and those partnerships? I want to open up to our colleagues, Hillary and Stacy and Sarah. Sarah, we were introducing ourselves a little bit before you joined. If you wouldn't mind just introducing who you are, where you're from, and what some of the housing things are that are on your mind.
Sure. Well, hi everyone. My name is Sarah Barr. I work at Amherst College, and I apologize that I was late. My stepson has a job and is not old enough to drive just yet.
It's okay.
Parent duty calls. Anyway, Amherst College, like many other places, is facing a pretty big housing issue that's impacting our ability to recruit and retain folks and just causing a lot of frustration for the workforce. But it's interesting to think about this like urban rural situation because even though Amherst is a well-resourced institution, we're in the same town as UMass and Hampshire and near Smith and Mount Holyoke. It's been hard to get the attention of developers because we're kind of small and rural, and there's not necessarily like the capacity in those in other organizations in the region. So it's interesting to reflect on this stuff because I definitely feel a bit stuck. You know, like we're
Mm.
not like the players are kind of mismatched. And it's like where do you start in the midst of all that? So that's kind of
Good.
just very curious about that.
Yeah, as you were listening to Kate and David speak, I know you came in on the tail end, and there'll be a recording of this sent out to you, so you'll see all of it. Um, was there any thoughts that you had for them, or questions or insights that maybe you would want to get a little data dump from them?
I think it really is like how to navigate like it's great to see developed projects, you know, and I'm going to definitely go deep into what's happening up at Dartmouth. But kind of like who are the players on the ground, or sort of like how does this even get started? Because it's
Mhm.
hard kind of since we're newer in this space to figure out what are those um like who to sort of identify as early partners to like deepen the network. Certainly healthcare is interesting. Our local hospital was purchased by a Boston hospital, so it's part of Brigham. And so they're not really even a local anchor anymore because everybody's much
Mm.
more interested in Boston. So again, kind of like how might we take early steps? Because I
That's a
think
good
all of
question.
the
Yeah.
things that you've mentioned are things that are totally doable. Um, but it's a rural place.
So David, any thoughts? Someone's getting off the ground in rural Massachusetts. They've got decent higher ed. They've got a community hospital that's now part of Boston's based Brigham that has an anchor mentality. Or any
Yeah.
early idea thoughts?
I'll just say two brief things on this and then pass it to Kate. I think the first thing on the foundation side, I was a treasurer for a place-based foundation here in DC, and we did an impact investing strategy. So I think I was a conversion health foundation. I think foundations are a key piece of this puzzle. I consider them anchors. And I think where they can step in is obviously every organization has its own culture, but if you have a risk adverse anchor, a foundation could come in with a loan guarantee to help those anchor, to really leverage the larger amount of dollars the anchors might be able to put in the projects and help really take any of the risk out of these projects, which are for the most part risk free. I mean, because most of the places that institutions start is with affordable housing. There's a lot of high capacity partners in this space, and we've seen almost no examples of institutions losing their money when they go this route. Um, I think in the rural context, I think the Dartmouth example is a really powerful one because they did really compile the necessary stakeholders to make it possible. But I would say the first place to start, we had the slide on the different assets your organization is willing to contribute. Really knowing what assets your organization is willing to contribute to the puzzle. I think most organizations are not talking about their balance sheet, their investment portfolio, and how they can put low interest capital into these projects. And I think that's a really critical component of helping to make this attractive for developers to come in and frankly make it pencil out for them to be able to do the projects you want to do. So if between you and the other anchor partners that you think are in this position, if some are willing to bring land, if some are willing to bring low interest capital, if anyone's able, I don't know what conditions were a part of the acquisition of that hospital, but usually there's something that Mass General Brigham needs to give to the community. So I don't know if there's any grant funding that's coming alongside of that. They have done grants to affordable housing in the Boston area, and they have made they're much earlier in their journey on impact investment, but they have made an impact investment as part of a loan fund in the Boston area. So I guess I would start there really. What assets are you willing to put into the conversation and be okay with when that comes up? And then can you identify some of these mission-driven partners that can help you either develop the pipeline for affordable housing, um, deploy the capital, or do the development? Kate?
Nice.
The only thing I would add is that even though the hospital in your community was purchased by a Boston-based health system, the community health needs assessment that they have to do every 3 years happens at the hospital level. It's not a system level activity. And so even though, there might be some increased attention or more physical people who are thinking about the system from the Boston area, that hospital is still responsible for every 3 years putting together a report that says what are the community health needs in the community or in the surrounding community of this particular hospital, and then putting together a plan for how they're going to implement address those community health needs. And it wouldn't be surprising to anyone on this call that housing, even though it's a health needs assessment, housing insecurity is rising to the top of every one of those community health needs assessment lists. And so that's, one thing I would, consider is looking at, what that community health needs assessment is saying and using that as a way to potentially engage the healthcare system in this conversation.
And one of the connections we can make, actually in your region, Trinity Health is one of the more high capacity partners in doing this type of impact investing, and they are actually through their community grants program, I know is supporting a coalition in Springfield to build a pipeline for affordable housing projects. And so obviously that's Springfield versus where you are outside the city, but they might just be a thought partner as they do a landscape analysis of how they can build a pipeline for affordable housing in the region.
That actually points to like one of the questions that I have in terms of strategy, because we do have a community foundation. They're located in Springfield and they serve like the 3 counties, but they're much more focused on Holyoke and Springfield, which are the major cities, which are in Hampden County, not Hampshire County. And I'm kind of curious if it's like a good strategy to kind of like start bringing together more of the players in the local community. So like the hospital, the other colleges, and maybe even form like a development corporation or some sort of group that's sort of being much more focused on the place.
Yep.
or sort of,
And
you know,
there's
like, because I can't get the attention of the community foundation because their passion is K through 12 education, which is awesome. And they're going to direct all their funds there. Amazing. But it's not economic development or the kinds
yeah,
of things that you're talking about.
yeah, maybe the two options there. So there's the Western Mass Anchor Collaborative, which has had its fits and starts, but we know the person who's kind of been the backbone for that, and there's kind of a workforce effort going on. So that person has been trying to bring together. It was supported by Bay State. I know they pulled back a little bit, was trying to bring together many of the anchors in the region, so we can at least connect you to the person
Sure.
who was the consultant for that effort, and maybe there's a way to bring it into this housing investment angle. And then I guess the other piece of it, as you think about angles for the foundation, I mean, obviously, if they're focused on K through 12, those kids' parents need a place that's affordable to live. So it's less about grant making. It's more about, okay, you're making grants on the education side, but can you use your balance sheet to help support the things, the wraparound supports that these families are going to need on the housing side. Um, so that could be one way to think about framing it from a K through 12 education standpoint.
Very good. Great question, Sarah. Thank you. Hillary.
Yeah, I mean, this is super helpful and interesting, and I hadn't really been thinking about healthcare as a contributor to housing, affordable housing. So good to know. And I'll look to Tony to tell me what's going on in this region.
Mhm.
Um, but I think we're sort of we're like at ground zero with this, and so we're in the we're like we need the grant right now to just get some staff time to put out the feelers and to do some of the basic feasibility of a like I know we can pull something off, and I know we know all the right people to bring to the table. I just need some staff capacity to do that work.
Mhm.
And then like I think, just like your chart about like, traditional investing, you know, this sort of slightly below market, and then like I feel like we're still in that little grant bucket, like to pull all the people together and do the feasibility to then make the case like, okay, here's the thing, where is it going to be located? Who's going to run it? Like those are the unanswered questions. Um, but just encouraging to see that there's sort of all this other interest and perhaps capacity out there to do the actual project once we figure out the location.
Well, I think what's great about this, Hillary, and David and Kate, I learned a lot from the examples that you provided. These are fantastic. And I think our community, the 30 members of this cohort in Campus Compact, we're going to make some of these case studies available to them for further study. And you've given me ideas of case studies that we could go deeper on and learn from as best practices. They all had to start somewhere, right, Hillary?
Right.
And so as we go in and do deep dives, maybe as a next phase of this work, as we think about it, as what we do phase two with Bobby Lauer and Campus Compact, is maybe we go deep and we try to understand what was the capacity building that had to happen at step one, and then step two and step three. What's interesting about this cohort is every one of the 30 members is on their own journey with various degrees of capacity, with various balance sheets. But what are the replicable lessons learned that people can, if they're just starting out, or if they're somewhere in the middle, or if they're a little bit more advanced? And that's what's interesting about the work. Stacy, before we break, I know you're taking notes for Bucknell. Any thoughts or questions before we wrap it up?
No, I think it really helped to hear. I would probably be very similar to what Hillary was sharing about. We have invested in the downtown, but that's been more downtown space, local economic development. So the only thing I'm curious about, there's a community strategies group in Bloomsburg, which is about 45 minutes away. They claim, I think they have some sort of nonprofit structure, and they claim to have 80 million in community investment, 32 million in future pending investment. I just don't, we've always been curious about their model. So that was one thing I was thinking of and kind of looking at. And Kaiser Permanente is one of your anchor partners, and they just merged with our regional medical system about 30
I
minutes
see.
away.
Yeah.
So kind of have that in the back of brain as
Good.
well.
So maybe just two really quick things to react to there. So many of our systems, unless they're really big and we're able to dedicate an FT, they cobble this together through some type of committee of different players in their organization. And the biggest hurdle is getting to yes on being open to allocating your investment portfolio assets to these type of projects.
Right.
There is limited grant dollars even for these organizations to do this type of work, and most of them have done it internally and not by bringing in outside consulting. I don't know of many examples in the Philly market of organizations going into the housing space, and definitely none related to impact investing. So I think it's a really ripe opportunity. You have a tremendous wealth of organizations. I know that um, the community benefit process that Kate was talking about, they were trying to introduce housing as a topic into that. I'm not sure. There's like a coalition of all the hospitals that do the community health needs assessments together. So that might be a place to start the conversation. But I would really encourage not actually doing the building yourselves, but finding the right partners once you are open to making the allocation of the resources that will help subsidize the projects, but also should hopefully be a sustainable way to go about doing it. Kate,
Fantastic.
any closing comments? Okay.
Thank you both for taking the time and the effort that you put into this excellent presentation. We're going to share this video with the 30 members of this cohort, as well as the slides, which Kate, thank you for sharing in advance. We'll be making introductions between your organization and you and Dave and Kate with the 30 members so that you all know each other. If they have follow-up, they can contact you directly. And if you're interested in learning more about how you can help any of them, should feel free of reaching out as well. So with that, I'll say thanks everyone for your time today. And
Thank
we'll see you
you.
soon.
Thank
Bye-bye.
you.
Bye.
Bye.
Bye, everybody.